guys, this is Dr. Hub. Today we are going to look at the Parasomnias. So Parasomnias, and we are going to look at some disorders under this. So under Parasomnias, there is nightmares. So nightmares, it is the dream anxiety disorder. So the sleep stage and characteristics. So there is REM. There is a memory of the event upon awakening. So there is memory of event. So this happens on awakening. Next, there is treatment. So in treatment, it is usually there is no treatment and there is a REM suppressants. There is REM suppressants, that is nothing but the TCA, and it may be used. Next, we move on to the night terror. So next, there is a concept of the night terror. So night terror is nothing but the sleep terror disorder. So it is a sleep terror disorder. And here the sleep stage and characteristics, it involves the stage 3 and stage 4. So it is awakened by a scream or with intense anxiety. So it is awakened. It is awakened by scream or intense anxiety. Intense anxiety. Next, there is no memory of the event the following day. There is no memory of the event the following day. So it is seen more frequently in case of children. So it is seen in case of children and more commonly in case of males, that is in case of boys. And it runs in his families, that is there is a family history. So how is the treatment? The treatment of night terrors will be by rarely the treatment is required, and benzodiazepines it may be used. So we can give the benzodiazepines. However, it is rarely it is required. Then we move on to what is known as the sleep talking. So what happens in case of sleep talking? So sleep talking, the stages involved is that there are all stages of sleep. So it occurs in case of all the stages of sleep. It is common in case of children. It is common in case of the children. And it usually involves a few words. It involves few words. And it may accompany night terrors and sleepwalking. So it can accompany the night terrors. So it can be associated with the night terrors and the sleepwalking. So how is the treatment of this sleep talking? Is that there is no treatment. Lastly, we move on to an interesting topic, that is sleepwalking. So we now look at the sleepwalking, and it is known as the somnambulism. Somnambulism. So somnambulism. So what are the characteristics? So it includes the stage 3 and the stage 4. Next, there is a sequence of behaviors without the full of consciousness. So there is sequence of behaviors. The sequence of behaviors, and it is without the full of consciousness. Without full of consciousness. Next is it may perform the perseverative behaviors. It may perform the perseverative behaviors. And it is usually terminates in awakening followed by confusion. So how does it end? It ends by the individual awakens and the individual remains confused what is happening. Next, it may return to sleep without any memory of the event. So the individual can get back to sleep without any memory of the event. So other thing to note is that it can begin at a young age. It can begin at a young age. It is common in case of the boys. So there may be a neurological condition that is affected. That is, it can be due to a neurological condition. There are some sleep deprivation exacerbates. Some sleep deprivation exacerbates. So treatment is by the patient safety has to be ensured. So treatment is by the patient safety. This has to be ensured. Next, the benzodiazepines to suppress the stage 3 and stage 4. Next, we have the benzodiazepines. So they are given to suppress the stage 3 and the stage 4. So this was about the parasomnias, and we have seen some disorders such as the nightmares, night terrors, sleep talking, as well as the sleep walking. To learn and grow daily like this, please do subscribe.